Hello, everybody, and welcome to a special edition of Tori's Tidbits. I'm here with Speaker Dan Hawkins, and we're here to talk about Medicaid expansion. So Dan's been in the legislature since 2012. He was past health chair, and he also is in the insurance industry. So that's huge, where he knows this completely. So Dan, could you tell us what is Medicaid expansion in layman's terms?
Well, first off, I want to say it's an honor being on Tori's Tidbits, because this is my first time to ever be on here, I think. So what a pleasure it is. So, whenever I go, Tori, I talk all over the state about Medicaid expansion and what it is and what it isn't. And invariably, I always ask, the very first question is, what do people think Medicaid expansion is? And most of the time they will tell me, well, it's just expanding services to the elderly or to the disabled or to kids. A lot of times kids comes up, and I'll tell them, no, that already is all covered. In fact, we already cover about 11 or 12 populations plus some other groups. So it's about 13 total that we already cover. No, what Medicaid expansion is it's expanding to a brand new group of people. And here is the definition of this expansion group. It's primarily childless adults aged 19 to 64 who are able-bodied and can work. And if they work 28 hours a week at a $10 an hour job, then they will make enough to be on the Affordable Care Act. And we talk about federal poverty level, but basically if you take 28 times 10 and you take that over an annualized period, that's about 15,000. Actually, the federal poverty level is 14,580. So as long as they make over that federal poverty level of 14,580, they get on the Affordable Care Act virtually free. They get a silver plan, and that silver plan it's a great plan. And 95% of their out-of-pocket expenses are subsidized, so they virtually pay nothing. And so I tell people, what is the one thing we have going on here in the state every single employer needs is employees. We are all hurting for employees, and so we need every single person working. We don't want them to just be laying around at home, and quite frankly, that's what Medicaid expansion allows people to do. If they don't have to work, and they get free health care, what do they need? That's not right for our people.
No, absolutely not. And what I find interesting is how many times we keep hearing, especially from the governor, but many folks saying over 70% of Kansans agree with this. But then they come and ask us, what is Medicaid expansion?
Exactly. 70% of the people agree with what? That's the question, is what? And at one time I asked for that. The very first poll showed 70%, and that was clear back in 2015. We were on the health. Were you there in 15?
No, I came in. I was elected in 16.
In 16. Well, you saw it then too, because we had it in health all those years. Yeah. But the first year was 15 when it really started, and they would always say that 70%. So I finally said, well, let me see that poll. Well, when I read the poll, I said, well, heck, I would even answer yes to that. Yeah. Because they were asking something like, well, the federal government's going to make it free for us to have health care for people who need it the most.
Right.
Well, of course, don't we want that? Yeah, people say yes. And so the poll is so leading, but once you start educating people with who is actually in that population, it changes drastically, actually down around 40%.
Well, and so I'm glad you brought up funding, because one of the biggest myths, and I'm going to call them myths because we're here to fact check, and is that it's free to the state of Kansas, and it's not. I don't remember what year it was. It was a couple of years ago that we got all the states who have expanded, and I think all of them but 2 went over budget.
Oh, way over budget. Well, first off, it's not free. It costs about $900 million total for the state of Kansas right now in 2024. If we were to expand Medicaid, of that we would have 10%. So our cost would be about $90 million. But that's if we hit it right. And what Tori is referring to is the fact that not a single state has ever hit it right. So they're saying that there's 150,000 people in Kansas that would be qualified to be on Medicaid expansion. Well, what we found out, states on average go over 95% of the count that they think. So let's take 95%. Let's just go to 100. What the heck? 5% more because my brain's feeble. That means 300,000 people instead of 150,000 in Kansas. That means our costs double.
Right.
So instead of 90 million, it's 180 million. And that's just right now. It goes up every single year. It does not go down. And what happens if the federal government decides that we can no longer do a 90-10 match?
When have you ever trusted the federal government?
Well, we don't trust them because they're always saying that, you do this, we'll do this, but then all of a sudden they pull back, and we still have to keep doing what we're doing, and that could cost us. That could literally take that price tag up to $500 million a year, and that is something we can't afford. We just can't afford it. A couple of things that the governor has said. The governor said that this will solve our rural healthcare problem, mainly with our rural hospitals. And I will tell you it won't. Matter of fact, I was working on, for our caucus today, I've got a little piece coming out from the original study that shows how much each hospital would get. And for our rural hospitals, they would get 7% of the total that goes to hospitals, which is about 26 million total. The top two get 25% of all dollars that goes to hospitals. The top 10 gets 55%, but the rural hospitals get 7%. For instance, one of them, I can't remember, Ottawa County maybe it is, gets $4,000. Is $4,000 going to save?
Is that going to save that hospital?
No. And I always go back to Fort Scott. When Fort Scott closed 3 years ago, Fort Scott was bleeding. They've been bleeding for quite a few years, and they were losing anywhere from $13 to $15 million a year. And Fort Scott, if Medicaid expansion would have been here, would have got about $2 million. So if you're losing, let's just go down to the bottom level. Let's say you're losing $13 million, and I give you $2 million. How long do you stay in business? Not long. And in fact, when the governor came out and said, well, if we would have had Medicaid expansion, Fort Scott would still be in business. The CEO of Fort Scott Hospital came out and said, yeah, maybe a couple more months, but that's it.
Well, I mean, think about any hospital is going to say, yes, I support free money.
Yes, absolutely.
Of course, why would you not? But
Absolutely.
That's not going to save them. And I think what we really need to do on the hospital side is we need to rethink the models of how hospitals are. A lot of these hospitals have way more beds than what maybe they possibly need. And healthcare in general is just changing.
Oh, it is. A couple of things that the governor's put into her plan. I want to talk about that real quick, if you don't mind, Tori. She put in a work requirement, which is something we always say, well, if we're going to have something like that, we'd have to have a work requirement. Well, let me show you what this work requirement looks like. If you have worked 1 hour, got one paycheck in the last 12 months, then you have satisfied the work requirement. And they look back one time a year. When you go up to renew, if you can show them a paycheck, you've satisfied the work requirement. That's not a work requirement.
No.
That doesn't even come close. The other thing is that they're going to tax the hospitals, they say, to pay this. They say this isn't going to cost the state anything. Well, who pays the tax? You do. I do. We do.
Well, and that's the thing is they're calling it a hospital fee. Yeah. It's a tax. It's a tax. So that's what frustrates me is, say that Medicaid expansion were to pass and the governor's plan were to go into action. When baby Bryn is born,
yes,
I am going to be paying for your health insurance if Medicaid expansion were to pass.
Yeah, because you're rich.
I am. Yeah, making what, $9,000 a year.
That's
up
right.
Here. Yes.
Yeah, so really what the governor has put together here is really kind of a sleight of hand, really just not, she's made the point that, well, I'm giving them everything they want. No, you're not, Governor. This is just a joke, is what you're making out of it, is a joke. Medicaid expansion is something that certainly I have been against clear back to 2015. But here's the deal. For all of your listeners, there is some things that we need to do. And the one thing that will solve the rural hospitals' problems is increasing the Medicaid reimbursement rate.
Absolutely.
And we're working on that right now. Yeah. Matter of fact, one of our good friends, Will Carpenter and Les Mason, are busy at work looking at all the codes. And some of them are paltry. Some of them, it's amazing how little we pay. We just need to up the reimbursement rates to where they can actually make it work instead of expanding a new welfare state that we can never shut down once we start.
And I believe That hasn't been touched in 17 years. I mean,
Some of them 30 years.
Yeah, so that definitely, obviously with Biden inflation and everything, we have to update those. So I'm glad that is a solid Republican solution that we have going on here in the House.
It is, but we're looking at all of it. You know, the 17 years is the doctors. The
doctors one, yes.
Yeah, the doctors' reimbursement rates. I was actually doing a speech at the Kansas Medical Society's Day on the Hill last week, and I said this to him. I said, listen, Medicaid expansion. You guys are, some of you are really clamoring and want Medicaid expansion. Let me see how much you really want it. I said, so a cash price for a doctor is about $120. Now I live in Wichita, maybe a little bit higher in Wichita than it is in Great Bend. I don't know. The insurance companies pay about $90. Medicare pays about $80. And I said to this group, I said, and Medicaid about 40. And the guy in the front row said, no, that's not right. It's 25. And I looked at him. I said, so how many patients do you want at $25 instead of 120? You can go broke. You can literally go broke serving this population. And you're clamoring for Medicaid expansion? That doesn't make any sense.
Well, and it's basically, I first thought, oh, they're doing work for free. No, they're losing money.
They're losing money.
And then on top of it, the number one myth is you get to keep your doctor.
Oh, yeah.
No, you don't get to keep your doctor.
You get what doctor you can find that wants to take you.
Yes. And I've heard from many doctors, and they don't want to speak out because their hospital supports it and they're employed by their hospital, but they don't support Medicaid expansion. And so that's what's unfortunate is some people who we really need to be hearing from are the physicians and those who are in the billing department and everything like that. We need to be hearing from them, and they don't support Medicaid expansion.
That's right. Yeah.
So anyways, I just want to say thank you to Dan for coming on and doing this. We're going to have in the newsletter this week everything with facts, myths, everything about Medicaid expansion. So please reach out. And this is our guy right here leading our caucus and making sure that we're standing up to Governor Kelly on this. So Dan, thank you very much.
Thanks, Tori. It's been a blast.